Hi, I'm Katie Amrine, and I am going to be talking with you about the National League for Nurses 8 core competencies for nurse educators. The first one is the facilitating learning. And to me, that basically means just creating a space for your students to flourish both academically and with their peers, and to develop skills using a variety of methods. And that can include, demonstration, providing hands-on activities for the students, a simple PowerPoint, having guest speakers to come in and talk about the area of their expertise, and then being able to recognize your students' strengths and weaknesses, and utilizing those items that you have identified to be able to adjust, your teaching technique or the environment as needed. And I facilitate this by I try to provide all my associates that work under me opportunities for learning. I try to give them block times out and areas throughout our clinic or the facility that they can go to, work on their documenting, to update themselves on current trends that are important to us in cardiac care. And then again, just being enthusiastic about learning, encouraging them to sign up for classes, and taking that Catch the Rhythm class or the EKG interpretation class, and just being excited about learning and teaching. Competency 2, to facilitate learner development and socialization. To me, that kind of goes hand in hand with the first competency, and really just getting students, and to me it's associates, exposure to the situations that will help them develop the tools that they're going to need to handle interactions with their peers, patients, family members, as well as other colleagues, just helping them build that value and belief system that they're going to be able to utilize as nurses themselves. And I do that. I help develop educational material for people in the clinic. And some of those that I've helped develop are warfarin clinic education, heart failure education, something as simple as a medication chart, so they know in the cardiac area, we focus on our beta blockers, our calcium channel blockers, just for them, quick charts for them to be able to look at, as well as some stuff with our devices. We do a lot of pacemaker and internal cardiac defibrillators, but just being able to get them exposed to that material and familiar with that and comfortable with that. Competency 3, nurse educators use a variety of strategies to assess and evaluate their teaching. It's important to know if the teaching was beneficial, if the students are able to follow and retain that information. Did that teaching fulfill its purpose? Were the goals and outcomes that were set, were those met? And was timely and meaningful feedback given? And this I do a lot with skills checkoffs in my area, a lot of teach back. I have associates demonstrate on each other, or on a patient. I'll go observe, did they use that information and the skills that were taught in an appropriate manner. Competency number 4, participate in curriculum design and evaluation of program outcomes. Staying current and relevant as a nurse is important to being able to provide teaching to these students, being able to provide updated information on the current healthcare trends. It's really hard to teach something that you don't know or you're not familiar with. So to me, I find it incredibly important to know what I'm speaking to my associates about, and to stay relevant to that facility's belief and purpose. The hospital I work for has, a mission statement, and we've had it for years, and it's still very applicable every day to how we learn and teach others. I continue to provide care as a nurse in my clinic, even though I am the clinic manager. I still make sure I'm out on the floor, once or twice a week, that I'm assigned to a clinic or a group of physician or nurse practitioner, that I am in the EMR, I'm documenting, I'm taking blood pressures, I'm hands-on with patients, drawing blood, starting IVs, that kind of thing, just so I know that what I'm teaching is still current and accurate, and that I'm still able to do it. Competency number 5, function as a change agent and leader. This is probably actually one of my favorite competencies that are on here. I do think that it's so important as an educator to be a change agent. A lot of times I think curriculums are probably set or made when you step into that type of role, and some of those may be fixed, but I think it's really necessary for a nurse educator to be able to voice their opinion, and then to be able to provide based practice to their administrator, nurse manager, to be able to try and implement change to improve student learning. And demonstrating leadership is also very important. I think as an educator, you're already in a position of authority, and you need to be able to also lead people. I display both of those. I develop all the policies and procedures in my area, and some of those have been in place for years that we reevaluate yearly just to make sure that they're still relevant. Competency number 6, to pursue continuous quality improvements in the nurse educator role. Really, I feel that learning is a lifelong obligation, and it's very necessary for a nurse educator. Being able to recognize the need to stay current and relevant, to be able to teach appropriately, and to support your colleagues in their quest for more education. I do attend seminars and classes currently in my field, device courses, leadership and management development courses. Competency number 7, engage in scholarship, utilizing evidence-based practice in your daily practice, being able to pull relevant literature, and then to be able to disseminate that to students or associates that you're teaching. And I do that with the development of the policies and procedures, and then utilizing that to measure your outcomes. And then the final competency number 8, function within the educational environment, really just recognizing how the facility or institution views education, staff education development, and what influences those, socially, politically, economically, and then being able to develop collaborations within that educational environment just to promote continued education. And I do that a lot in all of my management courses. We talk about what's important, what factors are influencing our abilities, and what barriers we have. So thank you for your time, and everyone have a good day.